Good afternoon, everyone. Thanks for joining us today. We're so excited to tell you more about LASIK. I'm Jonna, and I'm proud to introduce Dr. Blanton, who's a LASIK surgeon here at Inland Eye Institute, and he's going to talk to us today about LASIK. At the end, we'll have some Q&A, so if you have any questions throughout the process, just chat in the box to your right on the GoToWebinar area, and I'm pleased to introduce Dr. Blanton.
Thanks, Jonna. Okay, so next slide, please. For those of you who don't know me, I've been doing this for a long time. I'm a fellowship trained corneal specialist. I've done over 35,000 refractive procedures. I'm a Navy veteran. The first person I ever operated on was a Navy SEAL for this type of surgery. So I've got a lot of experience, and I'm going to share that with you today. And at the end, we'll give you an opportunity to ask questions about the procedure and about your eyes in general if you have any of those type of questions. All right, so next slide. So right now, of course, things are very different because of the whole COVID epidemic, the pandemic that's going on. So we have adapted our clinic to help keep you safe. So how do we do that? Basically, every day we're checking temperatures on all the staff members, on all the patients. We have some exposure questions, a kind of a screening questionnaire to make sure that you're not a high-risk person. And then if we need to postpone an appointment, we can do that and reschedule when you're in better shape to have an appointment. We're all doing social distancing. We wear masks, and we have all the patients wear masks. We limit the number of people in a room, and our appointment schedule is designed to keep the social distancing maximized. So if you have a friend or family member, we may ask them to wait outside rather than enter the building and increase the risk for transmission. Other things we're doing, of course, all the rooms are heavily sanitized between every patient visit. Any high-touch surface is repeatedly sanitized anytime there's any kind of an interaction with that surface. So let's talk about laser vision correction. It's a big decision. Many people spend a lot of time trying to figure out whether or not this is the right thing for them. They have questions about how does it work? You know, does it hurt? How safe is it? Can I afford it? All those kinds of questions. And just so you know, I've actually had the surgery done myself, so I'm a true believer. And I think it helps people who are considering it to know that the surgeon who's doing their surgery has actually had the surgery done himself. So I'll answer all these questions to the best of my ability, and then if there's further issues that you want investigated, we'll discuss those as well. So let's talk about the common vision problems. You know, we're all told, you know, you hear the terms myopia, which means nearsighted, hyperopia, which means farsighted, and then astigmatism. So we're going to show you what each of those is like. So for a nearsighted person, and this is typically the person who needs glasses when they're a young person, either in grade school or high school, they find out they can't see far away. So their distance vision is a problem, which is why we call them nearsighted. And in this example, you see that when they look at their iPhone, they can actually see it pretty well. But as their vision is further and further out, they start to get more blurry. So that's a nearsighted person, and that's by far our most common type of patient that we do LASIK surgery on. Next is farsighted. Farsighted people basically see better far away than they do up close, and that's why you see the phone is very blurry, but the computer on the wall is a little bit more visible. Now, farsightedness is a changing thing, and what I mean by that is when we're young and we can focus readily, we usually don't need glasses for farsightedness because our focusing capability allows us to see up close. But as we age, we lose the ability to focus, and it's typically in the mid-40s, about 45 or 46, when people start to notice they can't see up close and their phone starts to look like this. Wow, I can't read my phone anymore. And that's when they first need some kind of visual correction, is when they get to be in their mid-40s, unless they have extreme farsightedness, and that's when it's so bad that even as a young person they need to wear glasses or contact lenses. And then finally there's astigmatism. Now astigmatism, everybody's got a little bit, and what I mean by that is we can measure such tiny amounts that we can find some in almost everybody. But it becomes clinically relevant at some point, and when it does, everything's blurry. Up close, far away, mid-range, the whole gamut is blurry because the astigmatism affects all levels of vision. And most astigmatism comes from the cornea. The cornea is the clear outer layer on the front of the eye, the so-called window to the eye. And it is this part of the eye in which the LASIK surgery takes place. And the idea is we're going to reshape the eye. So for nearsighted people, we flatten the cornea. For farsighted people, we steepen the cornea. And for astigmatic people, we take their football-shaped cornea and make it more round like a basketball. And that is how we correct vision, by changing the shape of the cornea. So how do we do that? We use a laser to physically remove tissue. And by removing the tissue in the center, we flatten it. By removing tissue in the periphery, we steepen the cornea for farsighted people. And by creating a football shape on the front of the eye, it removes the astigmatism and makes your cornea more round. So we have the capability to treat all these refractive errors: nearsightedness, farsightedness, and astigmatism. And it's done by removing microscopic amounts of tissue from the cornea. And just to give you an idea, a human hair is about 150 microns thick. On the typical LASIK patient, we're removing maybe 30 microns. So it's a very, very tiny amount, and that's all it takes to take somebody from being horribly blind to seeing better than 20/20. And we do that basically on a daily basis around here. So it's a 3-step procedure. We make a flap on the front of the eye using a laser. And we don't use blades anymore. It's much, much safer to use a laser. Then we use a second laser called an excimer laser, and that is the laser that physically removes the tissue to reshape your corneal tissue. And then finally, we put the flap back into position where it bonds naturally. You don't need any sutures or anything like that. Your cornea actually has a pumping mechanism which holds the flap in place and seals it back down, so that you don't have to worry about stitches or anything like that during the surgery. And the vast majority of patients see better than 20/20 vision with today's modern LASIK. We get about a 90+% rate of better than 20/20 vision for our patients. So there is traditional LASIK, and that is the old-fashioned way when we used to use a blade to make the flap. We haven't done that for over a decade. We just don't do it anymore because there are risks. Even though the risks were very low, the risks are much lower if you use a laser. And so we have gone to the bladeless LASIK, or the all-laser procedure, using the IntraLase femtosecond laser to create the flap. That IntraLase has been around for many, many years. Millions and millions of flaps have been made with it. It's a super safe device, and so that's what we use now to do the flap creation on a LASIK patient. So our technology is Johnson & Johnson. This is the device, the two devices. The one on the left is the one that makes the flap. There's a chair in the middle. That's where the patient lays during the surgery. And then the laser on the right is the laser that actually reshapes your eye. And finally, you see a device over to the right. This is known as an aberrometer. This is the device that measures your prescription using a laser. And it is a very accurate way of measuring your prescription. And we use that to drive the laser beam. And when you do that, you get much better results than if you use the old-fashioned better 1, better 2 machine to guide the laser beam. So we use the IntraLase laser to create the flap, the Vizx laser to correct your eye, and the aberrometer to measure your eye, so that we get a nice map. And these maps are essentially like fingerprints. They're unique and individual to every person's eye. So you get a customized treatment on your eye for every eye. Now, so when you come in for your consult, we're going to ask you a lot of questions about what job you have, what your lifestyle is like, what hobbies are, what you like to do, because we want to give you the best possible outcome for your particular circumstances. So we're going to ask you some questions. We're going to measure your eyes very carefully. We're going to measure your eyes multiple times. And then we're going to come up with a customized treatment plan for you that will optimize your results. So let's go over some frequently asked questions. What are the risks? And we'll talk about each one of those. Can I really get rid of my glasses? And finally, will it hurt, and when can I go back to work? So with every surgical procedure, there are risks. The good news is with LASIK, the risks are very, very low. And as I've told you, I've had the procedure done myself. I've done it on many, many eye doctors. And in fact, the number of eye doctors, the percentage of eye doctors that have had this procedure is much higher than the general population. So the people who understand all the risks are still getting in line to get this procedure done, because they know if you go to a place that has a lot of experience and has the right equipment, the chances of you having a problem are very, very low. In fact, the risk of LASIK is less than the actual wearing of your contacts. With contacts, you're putting a foreign body in your eye every day with solutions that can be toxic over time, and there's a risk for infection. So all of those things cause risk when you're wearing contact lenses. So it's actually safer to have LASIK than it is to continue wearing your contact lenses. Now, the most common thing we see, can you go back for a second? The most common thing we see is over and under correction. That happens about 2% of the time. So in this circumstance, the patients end up much, much better than they started, but there's still a little bit of leftover prescription, and we need to go back and do a secondary procedure. So 98% of the time, it's one surgery and done, but 2% of the time, we have to go back and do another procedure. We don't do that for at least 3 months because we want to make sure you're completely healed and completely stable before we would go back. But there's about 2% who are going to need a touch-up after about 3 months. Now, it's very, very rare for someone to need glasses or contact lenses after surgery. The only kind of caveat that I would say about that is if you're in the mid-40s and beyond, and remember we talked about this before, you lose your ability to focus up close. And so if you're 45 and above and you have distance vision correction in both eyes, you're going to need to wear reading glasses for your up close vision. But if you don't want to do that, there's an option for you called monovision, where we do one eye for far away and one eye for close up. Now, as far as halos and starbursts, everybody has those initially in the first few weeks after surgery because the eye is still healing. But it's very, very rare for someone to have that on a long-term basis. And even the people that do, if I ask them, would you do it again? They almost always say yes. So it's not a debilitating kind of a thing, but it can happen in some patients, particularly in patients that have very high prescriptions. Infection is very, very rare, maybe 1 in 5,000, something like that. And usually if it happens, we can put you on antibiotics and control it, and you end up doing fine without complications, but it can happen. And finally, flap complications, about 1 in 1,000 will rub their flap or cause a wrinkle in their flap. It's usually very easy to fix by just going back to the operating room and laying the flap back down, but that's a very rare complication, about 1 in 1,000, something like that. So as you can see, the complications are very, very rare, and many of them are able to be fixed with either an antibiotic or another surgical procedure. So very rarely is it a cause for loss of vision. Okay, now, can I really get rid of my glasses? And the answer is absolutely yes. The only thing you need to worry about is what we've already mentioned, is people that are in their mid-40s and beyond may need glasses for up close. If they want to avoid that, they can have a procedure called monovision. So there's options for everybody, and that's what we'll spend time doing during your consult, is going over those options with you. Now, will it hurt? I can tell you this, you'll feel a little bit of a pressure sensation when we make the flap. It lasts for about 15 seconds, but it's not really pain, it's just a little bit of pressure, and that's it. Now, during the post-operative period, we're gonna want you to go to sleep on the first night, and I'm gonna give you a strong sleeping pill to help you sleep. Usually people wake up the next day, they may be a little bit light sensitive on the first day or two, and so we ask you to wear sunglasses, but almost everybody feels good enough to go do stuff. If you want to go golf or go shopping, those kinds of things are fine. We would ask that you not go to work the first day, just to kind of give your eyes a chance to heal. And then, you know, you'll be taking some eye drops for the first week to make your eye feel better, to lubricate it, and to make sure you don't get an infection. If you want to go back the next day, if you're self-employed, I think it's a reasonable thing for you to make that decision. But if you have an employer, I would say, you know, we do surgery on Thursdays, take Friday off, and you should be ready to go back to work on Monday. That's kind of a nice, convenient way to recuperate from the surgery. So will LASIK work for me? Well, that's why you need to come in for a consult. And by the way, the consults are completely free. There's no pressure. We're just going to examine your eyes and give you an idea about your candidacy, whether or not you're a good candidate. But the general principles are, you need to be at least 18 years of age. You want to be in good health. For example, diabetes can cause problems. Those kind of things we want to take a look at before we would recommend surgery. Your prescription needs to be stable, and we'll be able to tell you that by measuring your eyeglasses or looking at your contact lens prescription or looking at a clinical exam. And we want to make sure you don't have any serious eye disease like severe dry eye or a corneal problem like keratoconus. And we're going to screen you very carefully to make sure you don't have any of those problems before we would recommend the surgery. So about 10% of our patients end up being non-candidates, and we certainly are going to tell those people, because we don't want to operate on somebody who's not a good candidate. That's not good for us, it's not good for them. So we'll spend a great deal of time making sure that you are a good candidate. But in the meantime, you get a free eye exam, and you get to find out, you know, what your options are, all good stuff during the consultation. So that's going to take about an hour. And we're doing that. The reason it takes that long is we're going to do several exams on your eye with devices that we use to measure your cornea, to measure your glasses prescription. We're going to examine your eyes. We're going to do a refraction where we check to see what's the best prescription, what makes you see the best. We're not here to pressure you. We want you to tell us that you want the surgery, not that we're going to tell you that you need it, that kind of a thing. And we have great financing options. The bottom line is, people talk about how much does it cost. Well, it's actually more expensive to stay in your glasses and contact lenses because over time, those costs add up. And LASIK is a one and done for almost all people. So you stop spending all this money on glasses and contact lenses, and pretty soon you've paid for the procedure. And not only that, you get the value of not being dependent upon some external device like glasses or contact lenses to get your excellent vision. So during the preoperative exam, we're going to ask that you try to stay out of your contacts, because even the soft contact lens will subtly change the shape of your eye. And as I mentioned before, this surgery is all about changing the shape of your eye. So we want to be as accurate as we possibly can. The way we increase that level of accuracy is have you stay out of your contact lenses for at least a week if you're wearing soft, and at least 3 weeks if you're wearing hard, because as you can imagine, hard contacts are more likely to change the shape of your eye than a soft contact lens. So you'll accelerate your candidacy and your ability to get surgery if you follow those recommendations about staying out of your contact lenses. So on the day of surgery, what happens? Okay, so first of all, we don't want you to wear any makeup or perfume because those aromatic substances can affect the laser. We want you to be in comfortable clothing. You're going to need a driver because we're going to give you some medication to sedate you, and you're going to have bilateral eye surgery most likely. So obviously not a good idea to be driving yourself on that day. Although I can tell you that many patients, we check them a half an hour after the surgery, they already have driver level vision that quickly after their surgery. But once again, don't recommend that you drive for the following reasons. You're sedated and you've had surgery. Now, we always double check the numbers on the day of your surgery. Right before you go into the operating room, I'm going to go over all your numbers very carefully, make sure we have the right patient, the correct prescription, the correct eye, and the correct procedure for you. We're going to put some numbing drops in your eye. They work instantaneously. And then we're going to do the treatment, and the whole thing, both eyes, takes about 10 minutes. We're going to have you stick around for about a half an hour after the surgery. We want to make sure that you're doing well, that you're feeling good. We're going to examine your eyes one more time before you leave, and then we're going to go over the post-op instructions. And that includes encouraging you to go to sleep. We're going to give you a sleeping pill to help you do that. We're going to put some shields over your eyes to protect your eyes so that you don't rub or bump them while you're sleeping. And we're going to give you some sunglasses to wear home, and we're going to let you go home. And of course, we see everybody the next day to make sure they're doing well. And almost everybody has the level of vision where they can drive their cars without their prescription, and they feel pretty good and they want to do stuff. And as long as you're doing something, that's low risk, we don't want you to do anything where you might get hit in the eye like racquetball or karate or anything like that. We don't want you to put your head underwater in a swimming pool jacuzzi for a couple weeks. But other than that, you can do most activities, and most people are quite comfortable and ready to do those kinds of things on the first post-operative day. So go home and sleep, wear your eye shields. Now the eye shields will be worn at bedtime for 1 week, but on the first day, we want you to wear them all day and all night just to protect your eyes. And as I mentioned, we want you to avoid any kind of contact with a swimming pool, jacuzzi, spa, the ocean. We don't want you putting your head underwater for the first couple of weeks. You can certainly take a shower, and I just encourage people that when they're washing their face, you want to not rub across the front of your eye. And then we ask you that you not wear eye makeup for 1 week after the surgery, because to take it off requires you to rub on your eye. We don't want you to do that. We're going to see you on the first day after your surgery. Make sure you're doing well. And then we're going to have you come back at 1 week, 1 month, 3 months, 6 months, and for a year. And all those exams are covered by your initial surgical fee. So you don't have to worry about the cost of those exams. Those are all covered and part of our post-op care for you for this surgery. So how much does it cost? Our range is somewhere around $4,000 to $5,000, and that is for the custom all laser LASIK. And remember, we have great financing options, and the cost is going to pay for itself. In other words, when you stop buying your glasses and your contact lenses, you're going to recoup that money, and you're going to be ahead of the game if you have LASIK. So those fees include your consultation, which is totally free, and your pre-op exam. It covers the procedure, it covers the care for the first 12 months, and we have some policies, some packages where you can actually get your enhancement covered for either a year or 5 years or a lifetime. And of course, the lifetime enhancement package is a little more expensive than the 1 year package. So all those are available. You can pick and choose, and I don't care which package you pick, whichever one you want is fine with me. We got 0% financing for the first 2 years, so you get low interest financing through Care Credit. You can also use the cost of this on your tax form for health spending accounts to get a tax credit for this type of procedure. And we'll take cashier's checks, all major credit cards. So right now, because you're on the webinar, we're offering up to $500 off per eye for all the attendees, as long as you have your surgery by the 30th of June. And there's the phone number on there to call and schedule your consultation, 909-937-9230. So I'll give you some time to write that down. And we love what we do. It's a very gratifying type of surgery. Like I said, I've had it myself. We are excited to take care of anybody who's interested in this type of procedure. It's life-changing. Our patients are usually extremely satisfied. If you go into our Yelp reviews, you'll see we have outstanding reviews from all of our patients. So please feel free to look us up. We're proud of what we do and would be happy to help you. So I think now is the time for Q&A. Is the next slide the Q&A slide, Shauna?
Yeah, so
Okay.
actually, if anybody wants to unmute themselves and ask a question, or if they'd like to ask the question in the box to the right on the GoToWebinar, I'll gladly read them to Dr. Blanton as well. So we'll give everybody a few minutes here to either chat us a question or ask a question. So as someone chatted, I was told pregnancy changes your eyesight. Is that true?
Yes, so that's a great question. So if you're pregnant or breastfeeding, there are hormones in your bloodstream that can change your prescription. Now, it almost always goes back to what it was originally after you're done with the pregnancy and the breastfeeding. So you shouldn't expect any long-term changes, but because those changes occur during the time that you're pregnant or breastfeeding, we don't operate on people during those time frames. So we ask you to wait until after you've delivered, and if you're going to breastfeed, we want you to be free of breastfeeding for 3 months, and by that time your eyes should have returned to normal. We will always double check for stability to make sure your eyes are stable, but that's why we avoid operating on anybody who's pregnant or breastfeeding.
Are there any other questions? Give everybody one more minute here.
Sure.
All right. Well, Dr. Blanton, looks like it's a quiet group today. So
Okay, well,
I guess
everybody, go ahead.
Sorry, go ahead.
I would say everybody have a great weekend. Thanks for attending, and we'd love to take care of you. So come on in for your free consultation whenever you can.
Thank you, everyone. Have a great day.
Okay, bye-bye. Thanks, John.
Thank you. Bye.
Mm-hmm.